Hey, it's Dr. Matt here. I hope things are going well. One of the questions that comes up frequently is people with headaches, so challenges with headaches. And one of the things I always like to share with people is that aside from emergency situations, headaches are often a sign that you're at a limit or something's been reached, and it's your body's way of telling you to change something or letting you know you're doing something wrong or not getting enough of a nutrient, right? So generally, whether it's your stress levels, your eating patterns, so your nutrition, or your hydration levels, whatever it may be, you have to start taking a log of, especially when your headaches are coming on, when you've eaten, how much you've slept, and what your stress levels are like that day. So that's the one thing I'd recommend, especially if you're trying to target the cause of your headaches. The other thing I'd want to know about is the proper structure and function of the spine, right? So as I'm sure you'll remember, your brain has to control your body. It does that through your spinal cord. And I'll grab the spine here just so you can see a bit better. But all the information has to travel from your brain all the way down through your spinal cord. And nerves wrap around to the head, and some of those are pain sensing, and if they're compressed or not working right, they'll send signals saying, hey, my head aches, right? So if you're shifted and stuck in the spine, and there's pressure on those nerves, I'm sure you can guess it's probably a bad thing, right? So you guessed right, it's definitely a bad thing. So you want to know about that, and one of the ways, more often than not, you won't necessarily feel it, right? So the only way to know is to actually be checked by a family chiropractor and to actually know the proper structure and function of how things are working up top so that your body gets that important nutrient of motion through the spine and pressure off those nerves so you can work better. On my own, what I would address as well is think about your hydration, so how much water you're drinking, right? And definitely, our recommendation was ounces per pound of body weight, right? So, 8 cups of water is the baseline to start, but just start addressing your basic needs and keeping a water bottle at your desk, and also recording how much you sleep and when you've exercised and when you've eaten, essentially, right? The other thing I would do, just take postural breaks and actually stand up and move around. Because if you're standing up and moving around, not stuck, and from the side, this position at a desk all day actually puts strain on these areas so you don't work as well as you could, right? If I was going to do any stretches, one of the things, without being examined properly, this would be a suggestion, is just actually all the neck muscles, right? Actually take them to some sort of end range so they get motion. And just give yourself a little bit of overpressure and breathe into that. And you can do the opposite side too, but notice I'm looking down to my left hip and then down to my right hip, right? And when I'm looking down to my right hip, I'm actually feeling it on the right side of my upper back and my neck, because all those muscles in the back come all the way up, some of them attached to the base of the skull, and also the way the vertebrae move, or the bones that protect the important nerves, okay? So there's some places to start on your own, and then as well, if you've never had this checked, you won't know necessarily what's going on the inside. So it's really important to have that checked by a family chiropractor to know the proper structure and function of the most important system in your body. So I hope that helps, and if you have any questions, you can leave them in the comments or fire me a message. We'll talk to you soon. Bye for now.